Hi, this is Dr. David Tenner, and we are here at the Goldberg Clinic. Today is November 13th, 2015, and today we're joined by Henry Silvestris. Is that pronounce your last name right?
Yes.
Yes, okay. And Henry came to see us back in September of 2015, so it's only been a couple of months now that Henry's been working with Dr. Goldberg and I. And Henry came to see us with some pretty significant chronic digestive issues that he was having, and also joint pain that he was having as well. So, Henry, tell us a little bit about what your symptoms were like and the kind of problems that you were having that you came in for help for.
Okay, so my problems were in my wrist. I was diagnosed with Dequervain. Any sudden movement, like picking up a piece of paper or something relatively heavy, will cause a shooting pain in my hand. So it was really bad.
Okay, so you had a lot of joint pain in the wrists here.
Yes.
And on both sides.
Both sides.
And it made it very difficult for you to just accomplish very simple tasks, even picking up a piece of paper.
Yes.
Did you have problems? You like to ride your motorcycle, right?
Yes, and that was one of the main issues. I couldn't really ride my motorcycle for a long time. Mm-hmm. Also riding, and my biggest concern since I'm in chiropractic school was the use of my hands was limited, so I was really afraid.
Yeah, that's an important point. Henry is a student over at the Chiropractic College, Life College, and chiropractors work with their hands. And with all the wrist pain and discomfort and the swelling that he was having there, it would make it very difficult for him to practice and be able to see and help patients. So, Henry, when you were having these problems, particularly with the wrists and hands, this dates back as far as last year, right? When did it start happening?
Yes, July 2014.
Okay, so that's about a year and a half ago, a year and about 4 or 5 months. And what kind of treatments did you seek between that time and then coming to see us?
Okay, well, I tried chiropractic. That didn't help. It helped a little, but it plateaued. I tried ice, I tried heat, and laser therapy, and nothing worked.
Nothing worked. Okay, so you saw a bunch of chiropractors, different practitioners, did a bunch of therapies on you. Mm-hmm. Maybe got some temporary relief, but nothing long-lasting.
Nothing long-lasting.
You also sought help from a medical physician. What kind of treatments did you get there?
Well, I went to a hand specialist here in Atlanta, and immediately they recommended a steroid shot, and I paid for it. Pain went away, and they said if the pain comes back, you need to have surgery. So.
Okay, so they gave you a steroid shot, and that's actually very typical in a lot of medical offices. Whenever there's inflammation occurring, out come the steroids. And oftentimes the steroids will suppress the inflammatory response. The patient may get some temporary relief, but ultimately the problem comes back. Yeah. Right? That's what happened with you.
Yes, it came back and it was getting worse. So I didn't want the surgery, so I came here.
So when the steroids stopped working, they said, now we're going to go in there and do surgery.
Yes.
And what did they want? They wanted to cut the sheath that surrounds the tendons in your wrist.
Yes.
Yes, okay.
They wanted to cut the tendon sheath and basically release the pressure, but that wasn't the problem.
That wasn't the problem. Right, okay. All right, well, Henry came to see us in September after a long list of physicians that he had seen and various therapies that he had been treated with unsuccessfully. And so when he came in, I was pretty confident, and so was Dr. Goldberg, that your issues were not necessarily related to a biomechanical problem in there. We didn't think it was a structural issue. And so we instead looked at what was going on with your metabolic function and your biochemical function and whether that was contributing to the inflammation that was occurring in your joints. One of the more significant issues that Henry was having was related to his digestive tract. Mm-hmm. And the digestive system is really like the engine of the body. And when there's digestive problems going on, it can set the patient up for having other systemic type issues. Some of the more common ones include things like skin problems and joint issues. Mm-hmm. Dr. Goldberg often talks about the triad between the gut, the skin, and the joints. So in Henry's case, we were pretty confident that his joint issues were related to the digestive problems he was having. And when you have digestive problems, about 80% of the immune system is actually located down there. So the immune system becomes overactive, the joints start to get irritated, swelling and inflammation start. Mm-hmm. And the lab work that we ran on Henry confirmed that. He had a pretty significant bowel overgrowth where he was maldigesting carbohydrates considerably, and he was also putrefying a lot of the proteins he was eating. Maldigested food produces lots of waste products in the gut that can irritate the immune system, enter the systemic circulation, set off allergic responses, and create problems in the joints, which we see quite a bit with a lot of patients. So, Henry, you actually started on a program with us in October. On the 9th of October, today's November 13th. It's only been about 30 days.
Yes.
what kind of changes have you seen in your joints?
Well, the first week, the pain started going away slightly, and after that, I was able to start riding my bike again with no pain, riding with no pain, using the computer with no pain, and I lost a lot of weight. So I lost about 20
lost a lot of
pounds.
And Henry lost 20 pounds in the last 30 days as well.
Yes.
He's looking quite a bit trimmer, which is also a part of working on getting him healthier. After a long list of therapies and treatments over the course of the last year and a half, with no success, Henry now after just a few weeks is able to ride his bike again, use his wrist and his hand to write and pick things up and accomplish daily activities. Interestingly, the joint pain, as it reduced, your digestive issues got well at the same time too, didn't they? Tell us a little bit about that.
Yes, no more bloating. So that was very important because it caused a lot of pain and couldn't really sit straight or stand straight. I was hunchback for a while, but no more of that.
So as the digestion improved over the course of the last few weeks, the joints improved as well.
Yes.
Right, and we see the connection there, and we see that quite a bit with a lot of patients. Henry also lost 20 pounds, as he mentioned, and we didn't, that wasn't one of your major goals when you came in, but as a result of working on improving his health and getting everything working well and functioning well, one of the nice side effects of doing that is that the weight starts to normalize as well. You're feeling quite a bit lighter?
Yes, quite a bit.
Okay. All right, Henry, thank you very much for sharing your story. I think we've shed light on some important points in terms of your case. And like I said, it's only been a month, and I anticipate that we'll be able to continue to build on these improvements now and then also maintain them over time so that you can practice chiropractic without any issues, ride your bike without any issues, and function every day without any issues too. So congratulations, keep up the good work. We're going to continue to work with Henry, and we very much appreciate you sharing your story today. So thank you very much.
No problem, thank you.